What we're going to do today is demonstrate the various techniques that we offer in the office in order to reduce pain and discomfort and to correct what we call the vertebral subluxation. Okay, we're going to start with the spinal techniques and then go into the extraspinal techniques, which is the extremities. I'm going to demonstrate with Ron here. I'm going to ask Ron to lay on the table, and Ron's suffering with some low back problems, so we're going to first use a diversified technique with Ron. I'm going to lay your face down, sure. What to expect when you're in a chiropractic office is initially an examination and evaluation of the condition in order to study what's occurring in the human body and what needs to be done to correct that condition and bring the patient to more optimum health. All of our tables permit what's called flexion distraction, and what you'll see here is the table goes into a flexion mode, then restores to a normal position. What this allows is for the different joint segments to open up and reduce stress and discomfort in those areas. As this is being performed, the doctor of chiropractic will palpate each section to determine any area of restriction or limitation in those joint motions. Now, since I know the patient, I'm aware of his condition through prior visits and an examination, I'm palpating the second lumbar vertebrae and its restriction and motion. This will now follow what's called a Durafield leg check, where I'm looking at the position of the heels as I flex and relax the leg movements and determine any malposition of the pelvis. What I'm first going to administer with this patient is what's called the diversified technique. It's a hands-on technique to correct the restriction and misalignment at this segment. I'm going to ask Ron to lay on his right side facing me on his left. As I position Ron's body, it gives me optimum contact for that area, and I can actually motion it as I flex the hip and pelvis. Take a deep breath, blow it out, and just relax. Beautiful. Lay flat on your back. I'm now going to rotate the patient on the opposite side. Once again, positioning his pelvis where it's optimal for me to make the correction. I'm motioning each individual joint as I palpate. Once again, making my correction. Lay face up. Was everything comfortable?
Very, yes.
An adjustment should feel comfortable. It's important to ask the patient to make sure that the technique that was applied accommodates the condition and also accommodates the patient. Thank you.